tell me what I need to know about rotator cuff. Is it as common as I think it is?
It's actually, if we take the spine as our number one reason people come to physical therapy, then shoulder pain would be number two. Now, there's all kinds of different reasons for shoulder pain, and we keep throwing out the term rotator cuff, and we'll talk about that some more specifically. But based on age, you're more likely to have a certain reason for shoulder pain. Then if you're 20, your reason for shoulder pain is different than when you're 70. Mm-hmm. And we see all ages come through the clinic, obviously. But specifically for rotator cuff injuries, rotator cuff tears, those are more common as we get older. 55 plus, we start seeing more of those tears that just happen over time. Non-traumatic. It's just wear and tear.
Mm-hmm. So we're saying rotator cuff, and I know some people are thinking, wait a minute, it's rotator cup. Mm-hmm. And that's a common kind of misunderstanding. There's the ball and your shoulder at the top of the humerus bone, and that kind of goes into a socket. And the rotator cuff is a group of muscles that fit around and hold that bone in place. So it is indeed rotator cuff, right?
Right. We have people come in that will say their rotary cup has been injured, or the rotator cup, or the rotary cuff. It is rotator cuff, and it's four muscles that hook into the top of the arm bone, and as those muscles turn into tendons and then attach to the top of the humerus, the arm bone, it's like a cuff of a sleeve that forms around the top of that bone. And the entire purpose of the rotator cuff is to hold the ball and socket together. It creates a nice congruency. It holds it together so that it can work well. And then it's called rotator because those four muscles do rotate the humerus, the arm bone. They rotate it in a fashion that it frees it up so we can reach overhead or out to the side or behind our back. So it's for stability and it's for rotation.
So what are some of the symptoms that I have damaged or torn, somehow strained my rotator cuff?
Obviously, the first one's going to be pain. Pain's just naturally going to come with that. But then if the tear is large enough, you start to see inability to make certain motions. So obviously, reaching overhead is the one that we think of, but reaching straight out to the side also is very difficult if you have a tear. Now, what we see is if you have a tear or a partial tear, you still may be able to get your arm and hand all the way overhead. You still may be able to reach into that upper cabinet, but you make what we call a compensatory motion first. You may hike the shoulder up in order to get that arm overhead. It's not a pure motion. If you stand in front of a mirror and you take both arms and you start reaching out to the side with both arms, you'll notice that the injured side, the shoulder, begins rising towards the ear. And that's a compensatory movement. So with therapy, we work on strengthening and actually visualization and relearning motor control so that we can keep the shoulder in the proper position so that you have a better mechanical advantage to get that arm moved where you want it to.
So you're telling me, as part of therapy, you're going to instruct me at home to stand in front of the mirror and watch how I move?
That type of biofeedback is very important. So, well, it's just like in the gym. Every gym you go to, all the walls are mirrors, right?
Right.
And the reason for those mirrors is you need to be watching your form. Right.
It's not to shame me because I'm trying to lose that extra weight. That's what I always thought.
Yeah, it's not for flexing in the mirror or anything. It's to make sure that you've got proper form.
Okay. So we've talked a little bit about tears and strain, and there are lots of different ways that you can injure that rotator cuff. Let's walk through those. And do they feel different?
Okay. Let's first talk about what would be a traumatic tear. So what might cause a rotator cuff tear? The most common would be what we call an eccentric load. And eccentric means that you are lowering something. So a good example is, let's say that you have a toolbox that you're going to pull off of a high shelf or something. Mm-hmm. And darn it, somebody put more tools in that toolbox than you thought were in there. And as you slide that off, it weighs a lot more, and your arm has to come down quickly. That is likely to tear a muscle. More likely than you trying to pick the same toolbox up from the floor and then set it up on the shelf. And the reason for that is the element of surprise has been taken out of it. If you already picked it up from the floor, you know what weight you're dealing with, you can slowly, carefully put that up on the shelf. When you pull it off the shelf and it's a surprise, that's when the tear happens. So that can happen at any age, young, old, whatever. And if that's a complete type tear, honestly, those respond best to surgery. Some insurance companies are going to make you come to therapy first. If your therapist understands what's going on, they're probably going to say, hey, thank you for coming. I'll do my best working with you, but I'm going to send a note to your physician, and I think you need to see a surgeon. Now, what's more common is the overuse, the wear and tear over time. So the rotator cuff does tend to fray with age and with certain repetitive motions. Also, some people are more predisposed to rotator cuff breakdown based on how a certain bone is formed in their shoulder. So you have a protective bone on top of the shoulder called the acromion. And some textbooks funnel those into 3 different types based on how the acromion lips forward. Okay, so if that bone is coming down and then is moved towards the rotator cuff and the bursa, as you reach overhead through time, through the years, you're always bumping into that lip. Okay, that begins to fray the rotator cuff, and then you get a partial tear over time that can get larger. Those type of tears respond best to physical therapy. In fact, there's even studies out. A recent study from Finland showed that those type of tears, non-traumatic tears, they took, I think it was 157 patients, put them into 3 groups. One had an open rotator cuff tear. The others had an arthroscopic repair. The others only had physical therapy. And 2 years down the road, the results were the same. So, and the results were based on function and subjective report of pain. How does the patient feel? So if someone were to tell me, hey, you've got a partial rotator cuff tear, in 2 years, these are going to be the results if you go to physical therapy, or 2 years, these are going to be the results if you go under the knife, which would you like to do? If the results are the same, I'm going to go work out.
Yeah, that's an easy choice for me on that one. No surgical risk and no surgical recovery.
Right.
Yeah. Hey, I invited you to either call or text us with your questions, and that's what someone has done. Middle-aged man asking about a rotator cuff injury during sleep. Now, that's kind of odd. Can you injure yourself in the way you sleep? Is your position put you at risk?
Stated like that, yes, it can put you at risk. And I think the way it was texted was, is it common for a middle-aged man to tear his rotator cuff during sleep? The answer to that would be no. However, it would be common for it to be aggravated and be noted the next morning, depending on how you slept. So, a couple things. Middle-aged, that partial rotator cuff tear likely was there to begin with. And then based on how he slept, lying directly on the shoulder, lying with the arm overhead for an extended period of time, you can wake up with a lot of pain that way. I sat through a shoulder seminar recently, a couple months ago, and the surgeon, who was a surgeon here in Fort Wayne, used a little memory device that I thought was helpful. He said 60% of people over the age of 60 have a rotator cuff tear. Whether you know it or not, 60% of the people over the age of 60 have a rotator cuff tear. And that just happens with time and wear and tear. Does not mean you need surgery. Lots of people are walking around with partial rotator cuff tears. I have a diagnosed partial rotator cuff tear. I still get through my day fine, but I have to be more careful with my right shoulder than my left shoulder.
So tell me about sleep. Where should I put my arm to minimize the stress on that shoulder joint?
I'd say 2 things. Don't lie directly on the shoulder. So if you've got that arm tucked up underneath you and you're lying down on it, that does pinch off or potentially reduce the blood supply of the rotator cuff there. If listeners want to Google or look up the watershed theory, where we have decreased blood flow to a certain area of the rotator cuff, that's called the watershed principle. That is aggravated by getting that elbow tucked up against your side and then lying on it. And then also, we talked about the 3 different shapes of the acromion in the earlier part of the show. If you have a pinching phenomenon, impingement, lying with your arm directly over your head is also going to be pinching that. And if you're sleeping, that's an extended duration of time.
Okay, so good point there. Let's get out to the phone. So, Jason, throw on your headphones there. And we're going to get to Tim with a question for you. Tim, go right ahead. Hey, Tim, there you are. Go right ahead. What's your question for Jason Hazelett?
Yes, about back in April, I took a fall and I went back to catch myself with my arm. And I knew immediately I had a rotator cuff tear because I've had them before. And the doctor took a regular x-ray, found out that I had between moderate to severe arthritis, and then an MRI, which showed that I did have 2 rotator cuff tears. And she is sort of advising me that just hold on, because a few years down the road, I may need a replacement for my shoulder. And she said the rotator cuff tears would probably not heal anyway if she went in to fix those. And I was just wondering if there was anything I could do to help ease it. She's been giving me cortisone shots, which did help, but they do wear off. And, at night after working, I can still work and stuff. I can't go to certain positions with my arm, but I can still do pretty much what I want. But at night, it just aches like a toothache would ache.
Yeah. I hear that commonly. How old are you?
Well, I'll be 63 in October.
Okay. All right. So I think, now, of course, I have not seen you, but I think she's given you good advice. And she's probably telling you to hold off because based on the x-ray, she's telling you in a couple years or a few years, you're looking at a shoulder replacement. Did I hear you right?
Yes.
Okay. So in the meantime, you want to get your shoulder as stable and strong as possible without aggravating things. There are certain muscles and motions that we kind of ignore in our normal workout routine that a good physical therapist can help you figure out how to activate. And those motions and muscles help keep the humerus, the ball portion of the ball and socket joint, help keep it down in the socket so that you aren't getting that pinching sensation that occurs when you have weakness in certain parts. So as boring as it can be, you actually do need to do certain types of stretches and exercises. And I'm always big about getting the neck musculature stretched out as well, and then getting good scapular or shoulder blade strength in there as well. Because if we're ignoring those 2 parts, you're just missing a lot of the equation. And getting flexibility in the neck muscles, the upper trapezius muscle, all that plays into the shoulder. And so that's important. But then you mentioned sleeping. This is just going to be tough for you to be straight, but having more than one pillow when you sleep, and I don't mean under the head, is going to be helpful. So use a pillow how you want with your head, but if you can get your arm away from your body to some degree by getting a pillow tucked up underneath there, that's going to give you a little bit of relief. I would not sleep directly on the shoulder. I would not sleep with the arm over the head, but tuck that pillow up underneath your arm for some separation, if you're understanding me on that.
Yes. Actually, I've been doing that just because it's just by accident. You try to figure out what's going to make my shoulder more comfortable. And when I do tuck a pillow up underneath the bad arm and lay on the opposite shoulder, it gives me more comfort.
Yeah, that makes sense. I'd keep doing that and play with different pillow sizes and see if that helps more.
Hey, Tim, thanks for your call. We sure appreciate it. Thanks for jumping in here with us on HealthCall Live. Let me ask you some just real general sort of tips for shoulder strengthening. You mentioned exercises that will get that done. What are some things that we can all do? Okay. Postural muscles make a big difference for the rotator cuff and the shoulder mechanics. So what I mean by that is, we all talk about bad posture, whether your head is forward of your shoulders or your upper back is hunched forward. All that makes a huge difference in the shoulder. So if our upper back is hunched forward to some degree, then when we go to raise our arm overhead, we begin to pinch up against that acromion process that I talked about earlier sooner. So little things like learning how to be standing up straight prior to reaching overhead prevents that pinching in the shoulder. So working on your posture in the mirror is important. Working on postural muscles. What I mean by that is don't work on the beach body muscles, the beach muscles, okay? Don't just be going and doing your biceps and your chest. Yeah. So you've got to work the upper back. You got to do balance. If you're in the gym and you're doing bench press, then you've got to follow up that with rows, seated rows, bent over rows, one arm rows, something like that. Get things balanced out.
But then also we got to figure out how to work the smaller rotator cuff muscles that aren't visible to most people. That's where the therapist comes in and can teach you how to work these muscles, or you can look it up online, but we want to make sure your form is correct.
Excellent. Let's see. Real quick, I'm going to ask you for about 30-second answer here.
Okay.
60 years old, worked as a painter or carpenter for 40 years. When working overhead or driving, arms and hands will go numb.
Yes. There could be a lot of different things with that. The first thing that pops in my head is something called thoracic outlet syndrome, which would have to do with pinching of the nerves that run underneath the collarbone here and out from the side neck muscles. So there's some different stretches that we'd have to put into play for that. There's tests that I'd have to see first to see if that's the reason, because also working overhead, you tend to look up. It could just be that the nerve roots of the neck are getting pinched, and that's why the arm's going numb. So that's a differential diagnosis thing. I would see a doctor or a therapist to get a good answer on that.
The law in Indiana recently changed, and I no longer need a physician's referral to see a physical therapist, correct?
Correct. Since 2013, you can come straight to a physical therapist to get your physical therapy. The only reason you might need a physician's referral is if your insurance requires it, and there's really only about 2 insurances that still require it.
Okay, so if I have an ache, a pain, a strain, something that's been bothering me, make an appointment, come in and see a physical therapist, what's the first thing you're going to do? Obviously an evaluation. What's that going to be?
As far as what gets done,
yeah,
it's a lot of talking and tests. And sometimes patients feel like they don't get much done on the first visit, but that's because we take 45 minutes to get to know you, ask questions, do special tests. We've got the big picture now, and then we can get into proper treatment. But definitely, you're not going to go talk to a therapist and they have one hand on the door and they just want to get out of the room. They take time, they listen, and then they understand the problem.
And chances are you're going to have me working through some exercise and that type of thing. You're never going to ask me to do more than I can accomplish. How tough is physical therapy? It's got a kind of a reputation of being a little painful.
Oh, I've been called physical terrorist, whatever. There's all different kinds of things. Yeah. Therapy can be as simple as hands-on work and massage, and it feels good, and people never want to quit coming, if that is what the diagnosis calls for. After a total knee, it is uncomfortable because we have to push you to get that range of motion. We did not talk about frozen shoulder, also called adhesive capsulitis today. That is a painful condition that requires a lot of pushing and stretching. So yes, there is pain involved, but it's just diagnosis specific.
All right, so if you've got an ache or a pain, don't be shy. You can get with Jason Hazelett or the team at Steppin Physical Therapy. They have 4 locations: Calhoun Street, Jefferson Boulevard, Coldwater Road, and Auburn Road, and they'll be returning. Jason will be here occasionally, but next time around on Health Call, August 3rd, we're going to focus on how physical therapy can treat vertigo and balance disorders.
Yeah, Craig Vandermaiden will be here for that.
And so that is August 3rd on Health Call Live.